All right, now we were going to be discussing this a little bit further on, particularly looking at schools. As we understand, a lot of those that are affected by TB are also among those that are less than 20 years of age. Now joining us via Zoom is Coceka Nogoduka. She's the Chief Director for Care and Support in Schools at the Department of Basic Education. Now, while we wait for her to join us, I mean, one of the statistics that have just been read out by CAPRISA are quite shocking, but I understand that we've got Coceka Nogoduka now. She's the Chief Director for Care and Support in Schools at the Department of Basic Education. Thank you so much for joining us, ma'am. Now, if you've been listening to Dr. Naidoo, you know, giving us those statistics, which are quite shocking, 2 deaths every 9 minutes from TB in South Africa. I remember a recent study, that was published, finding that South Africa TB is a leading cause of death, especially among those 20-year-olds, those that are less than 20 years of age. In fact, talk to us about just some of the interventions and preventative measures that have been activated, especially at school level.
Thank you very much, and good afternoon to you and your viewers today. As you've heard and you've articulated, we are at the South African TB Conference. And as the education sector, we have used this platform to galvanize for support and advocacy to drive the TB response in the education sector. The number of infected adolescents is not different from the adult population in South Africa that are infected with TB. Our concern is that 13 million of these adolescents, which is the school-going age, congregate in schools every day. So we're concerned as a sector. So we've decided to strengthen our response against TB. So this morning, we had a session where we were discussing the areas for strengthening. And just to list a few, the first one for us is the environmental space in our schools, to make sure that our schools do not transmit TB. Therefore, we have to make sure that ventilation occurs. I think you are aware that our schools, in most of our schools, we do have overcrowding. We do have infrastructure challenges. So we are working with our infrastructure partners and our infrastructure department to make sure that ventilation in our classrooms is adequate, but also educators and learners are opening windows when they are in the classroom to make sure that there's flow of air. Through the Integrated School Health Platform, we want to strengthen the screening of TB amongst our learners and our school staff to make sure that children that come to school don't bring in the TB bacteria into the school and infect other learners. So we will be working with our health partners to make sure that there's access, but also increase coverage on screening and make sure that all learners are screened, and those that are presumed to have TB, they get tested and initiated on treatment. We also have to teach, because you are aware that as the education sector, our key strongest point is teaching and learning. So in our curriculum, we are working with our curriculum partners to make sure that we start teaching about TB at an earlier age, TB prevention more so, the coughing etiquette, making sure that we wash our hands, making sure that also we leverage on some of the lessons that we've learned with COVID prevention, making sure that we keep our surfaces clean, we mask where it's possible, but make sure that we continuously give this messaging to our learners at an early age. And also what we've learned as a sector is that when we teach our learners at school, before we go
into those solutions, ma'am, you mentioned screening. And I know that one of the challenges, particularly not only just for basic education, but just in general in this country, is tracing, diagnosis, as well as, of course, treatment. So in terms of the screening, what level are we at the moment? Is there any form of screening taking place at schools?
At schools, currently, the form of screening that takes place is the questionnaire, where we ask questions: have you been coughing, weight loss, the basic minimum screening. But with the first prevalence of TB prevalence study that was done in this country, we have learned through the Department of Health that screening is suboptimal. It does not pick up all TB cases. Therefore, we have to do better screening. So the Department of Health now has provided mobile X-ray machines that can come to our schools and do proper screening of infections.
And what would that entail for the Department of Education to do that? Because, I mean, if we're looking at some of these numbers that have just been read out at that conference saying that at least 2 deaths every 9 minutes in South Africa, you know, how wide scale are you going to be doing this? Is there a plan in place, and are you targeting all provinces?
Yes, there is a plan in place. You would remember I spoke about the Integrated School Health Program. That is a program that brings health services into the schools. So we are partnering with the Department of Health. We are partnering with health NGOs that will come into the schools and be able to screen the learners. And of course, the Integrated School Health Program talks about parental consent. So we will be urging our parents to give consent to the children to be screened. But also, we are going to be working with public health facilities that are closer to the schools through the youth-friendly services and youth-friendly zones. The Department of Health will be making sure that our adolescents, when they go to the clinics, they also get screened for TB.
All right, ma'am, thank you so much for your time this afternoon. Really do appreciate it. That was Coceka Nogoduka. She's the Chief Director for Care and Support in Schools at the Department of Basic Education, of course, coming to us live there from Durban, where the TB conference is currently taking place.